grew up doing competitive gymnastics. I was always athletic. I danced growing up. When I was 16, I tore my ACL in gymnastics. That pretty much ended my life, and I thought it was over. I was actually intending to go to college to compete, and when they told me I'll never walk the same again, I was really depressed. They said, don't get a surgery and just rehab it and you'll be fine. So I quit gymnastics and I started competitive springboard diving. And again, I blew my knee out my sophomore year of college in dance team. The ACL surgery, the recovery was pretty long. I couldn't compete in competitive diving in college for 1 year. I had to do a lot of physical therapy every day, and I was on crutches for 6 months. After that, I still was doing physical therapy for pretty much a whole year, and then I rehabbed myself and then went back to competing, but it was always off and there was always like a little bit of pain. There was a lot of strength because I kept my muscles strong. I was in competitive break dancing, professional dancer and a professional stunt woman. I was flipping off stages. I was doing all sorts of crazy kind of dancing on cement and wood. There was always like a little bit of pain and discomfort. Dancing for long hours would cause a lot of pain. I have a pretty high pain threshold, so I would always just push through it. If there was one day that I worked out my knee too much, I would just ice it at the end of the day, do yoga, do strengthening exercises. I'd make sure that I wasn't eating too much sugar. I actually did go to a doctor in Beverly Hills who prescribed me Tramadol, a painkiller. Tramadol basically makes you feel pretty high, you feel numb, but at the end of the day, you're actually doing more damage to yourself because you can't feel it. I did get a cortisone injection. I also got a hyaluronic injection. I feel like those things might have helped a little bit, but they're only temporary. At some point I was like, I can't deal with this pain. I knew that I would be getting arthritis just from having an ACL surgery. I knew that my cartilage was messed up. I had 3 different orthopedic surgeons evaluate my knee, and I got the MRI, I got x-rays, and they all told me that the surgery must have failed and that I have arthritis, bone on bone. Getting another ACL surgery was probably not a good idea because the pins were put in the wrong place, a knee replacement later in my life. My sister found out that I was going to fly myself to Florida to possibly get stem cell treatment. And she said that there was a location right in Oceanside, which is only 2 hours away from Los Angeles, for me to do this. In 6 months, I definitely started feeling way different, and my flexibility started coming back, and generally walking without pain, being able to dance without pain, jump around without pain, and that's pretty amazing. I was pretty surprised. I would definitely highly suggest all the athletes out there who have ankle or knee problems from years of jumping around, flipping, to do stem cell.
Couldn't hurt me, it could only help me. Didn't have long recovery times, and so I tried it. Was just excited with the results. I mean, it was amazing. Like, it was a miracle. I'm so glad I did it.